This is Portfolio Africa, a show where we present deal makers, creators, and leaders from the private and public sectors that are working to transform Africa for the better. To share highlights from their work, I am Kemi Osukoya, your host. A healthy population equals a healthy economy. Yet, many governments around the world too often don't invest in their healthcare sector, leaving their population and economic exposed to pandemic consequences. This has been the case in many African countries. However, some countries are now addressing this vital issue, coming up with innovative solutions through public and private partnership to tackle malaria, HIV, cancer, and other non-communicable diseases in Africa. Equatorial Guinea is one of those countries in Africa and from around the world that have put healthcare sector at the heart of its economic. Working in partnership with the private sector, the government is tackling the issue of malaria in the country and building a sustainable healthcare infrastructure and data that will allow it not only to address any future health emergencies, it will also help it to provide quality and affordable health coverage for its population. Their innovative project just won an award at this year's Concordia Summit. I sat down with the Deputy Minister of Health and Social Welfare, His Excellency Mitoa Ondo Aye Kara, and Christopher Schwab, President and CEO Medical Care Development, a US-based company that collaborates on the project. I want to congratulate you on winning the P3 award. What was the experience like? Coming up with the idea and the process that you've gone through to create the product that you created.
I think it has been a very enriching experience for us just to go through and reflect on the long history of partnership that we have been able to put together, recognize the incredible achievement, and be able to summarize that and to the organizers of the award. And even that single process was, again, a very collaborative among all the different partners. We all made our contribution to be able to recognize the individual so significant achievements that we all have made during the course of this period of time. And then go through the same process with the organization itself and be part of this unique, award. It has been quite enriching,
Okay.
at least for me. So, I don't know, Chris.
And you?
I concur with what the Vice Minister has said. I mean, it's really been an amazing experience. It's just another one of the examples of the kind of extraordinary experiences we've had as a partnership. I mean, our focus on a day-to-day basis is on eliminating malaria from Bioko Island, and that involves hundreds of people working in Equatorial Guinea within the Ministry of Health, within this project, which is part of the National Malaria Control Program, going out on a day-to-day basis, spraying the inside of homes, delivering bed nets, working in the communities to look for larval breeding sites and managing those breeding sites, working in the health facilities to diagnose and treat people who still may have malaria. So it's a major effort on a day-to-day basis. But above all of that and coordinating all of that, of course, is the activities of at the management and policy level that are going on, and it takes a team.
It takes a village.
It takes a village to do it, and we really have that. And I mean, as an outside organization, medical care development, it's an incredible honor to be able to be engaged, working in a partnership that is led by an incredible government in Equatorial Guinea, where there is not only the leadership and commitment at the level of the Ministry of Health, but really importantly at the level of the presidency, and then also at the funding level with the Ministry of Mines and Hydrocarbon, where the minister has been absolutely the biggest champion of this program. And with that kind of commitment comes, which is known very well in the country, right, that the government is fully behind this, comes in fact then collaboration on an intersectoral basis, which the ministry then coordinates, and which then gives the program an opportunity to get in at the community level where change ultimately and the intervention needs to take place. And you don't have that kind of credibility unless you have that kind of commitment. So it's extraordinary.
Okay. This is an ideal public and private partnership. And in Africa, especially at this period, yesterday at the UN, one of the major programs that was launched was the new World Health Organization promoting universal health coverage all around the world, but in particular in Africa. In part of Africa, in DRC right now, they are dealing with Ebola. And is a recurring thing, like every 2 years or every 3 years. Malaria has always been a major issue. So usually health has not been a priority for a lot of policymakers in Africa. What was it that made it a priority for your country?
Well, I think our country is really a vision that the president carried itself, and from the beginning he wanted to make a difference in terms of how to invest the oil revenue. And we had the experience of what had happened with our neighboring countries. So we were one of the poorest countries in the continent. So since we already had that experience, he knew for sure what we shouldn't be doing. So we invested massively on infrastructure. So what it means to have the best roads right now in the continent, we have that. Electricity is not an issue. And we have certainly invested in improving airport, ports, and having the best telecommunication network infrastructure. And we have invested heavily also in hospital infrastructure and human development to center instance, because when you compare from when we started to where we are today in terms of the rate per capita of doctors, and we have the highest, one of the highest in Africa, and all that in tandem put us in the first country that invests more in health. However, the vision is not to stop there, because as you know, as you're using the most innovative tool technology-wise, that needs to be accompanied with a shift also in the way that you manage your resources, the way you deliver your care. So it means that also we have to change the way our health system works. And this is where this projects come into play, where by investing in a project like this, we have the best of mind in terms of the academia, in terms of management of projects that can be absorbed and integrated within the ministry, so that we can start redefining how health system should function and work in developing or countries that are in the process of development, like the ones we have in the African continent. This is where I think that we have a unique opportunity in Equatorial Guinea, because you have the leadership, you have the resources, you have the partners to do that in a way that it makes sense for us. And this is what we are trying to do in Equatorial Guinea.
Hey, could you talk to the PP3 to the power of
So, which is basically, and that paradigm that we think can be the model of how to deliver care for developing countries in the 21st century, is what we have called the PPP Power 2, which is the evolution between project to program and later on to become a policy.
Okay. You were talking earlier on, before we started the interview, how what this experience meant to you. And you mentioned it earlier on as an outsider. How does that impact you personally?
Well, on a very personal level, I mean, it's an honor to be able to be involved in an essential health service delivery program addressing the scourge that malaria was. I mean, when we entered in Equatorial Guinea in late 2003, no matter who you met, they talked about the number of episodes of malaria they had a year. You could visit the local cemeteries and see the tombstones of infants and young children who had died as a result of malaria. Everybody was touched by it, and so it was a visceral, direct story of everybody that we worked with. And to see that change so drastically as a result of this incredible partnership, it's been a blessing. I mean, it's, one hopes when one goes into international development work that this is what you're going to have an opportunity to do. But honestly, for a non-governmental organization like Medical Care Development, I think to have had the opportunity to be at the table with and engaged in an activity that is not just a pilot project or a 2 to 3 year activity. This is a 15 and now 20-year commitment by the government and by the oil companies. We've had an opportunity to not only do this on an experimental basis to get a proof of concept and show new technologies. We've had an opportunity to take this to scale, and because of the foresight of government and because the institutional wherewithal within government, the statutory authority, the legal construct, the institutional mechanism, and the public finance mechanisms are there. What we've been working on as a project has become part of the National Malaria Control Program, and as the Vice Minister has said, it's become part of policy. That means it's scaled and it's sustainable, and I think that's really the hallmark of this program.
So this program, you will be able to implement the scheme that you use into other aspects of healthcare in the sector.
Definitely, because the insight we had as implementing the malaria program, as you can imagine, we have gone through 2 prior clinical trials now with the malaria vaccine, and the 3rd one is underway, and we have had massive data to understand the epidemiology of the people. So their institute is being developed, the research institute, as a consequence, because we are learning more about the epidemiology, and we are starting to think how we can have the highest impact on our people best health delivery, because malaria is just one piece of that have helped us understand and get into contact with the community and how their community interact each other, and how to best approach the community in order to improve their health services. I think all that knowledge, coupled with the cadre of expertise in the scientific field, it gives us a unique opportunity to design something that would help us move toward universal healthcare and also to improve the quality of those services.
Okay, you mentioned data, which is very, very unique in Africa in all aspects, not just in the healthcare industry, because there is no data regarding diseases and how to take care of those things. And that's one of the issues that you're currently working on right now. So my question to you is, in general, in DRC, for example, and in 2014, when the Ebola broke out, there were a lot of issues in trying to get the community involved. And so how did you go about convincing the community that this is right for them? Because in most cases, people are like, Africans are very skeptical when it comes to things like that.
Yeah.
And that's been the issue in DRC in particular, like regarding vaccination, like, oh no, I don't want to get this. So how did you go about convincing the community that this is good for them and on the long term? And what lesson can other African ministers, African leaders, what lessons can they learn from your experience?
I think in a project like this, where you have multiple sources of support of our partners' intervention, it's very important that they understand the cultural context. I think this is where the role of the government comes, and which is very important. The role of the government should be to situate the synergy that is coming from the global level to contextualize it at the country level, and to understand what is the mindset, what is the culture of the people, so that the intervention are very culturally attuned with what is going on sociologically speaking. So in that context, we have been a vehicle to make sure that we don't do anything that is counterproductive to cultural sensitivity. So we make sure that we will understand how people think, how they perceive about certain intervention, and we will make sure that we will talk to key figures within the community. I think the parliamentarians are very important to that scheme of stakeholders. We will go to the community and select people who are also coming from that community to become champions within their own community, and make sure that they will be the one to get all the concern, so that we will address and take the time to address those concerns, so that everybody is comfortable. And that's what we are doing. I think that to take the time to understand and go through and walk the people through that process is even more important, because it shouldn't be the pressure of time by getting what you're trying to do, but getting there in the right way with everybody that is required. So it's important that the committee is a second piece of everything that we're doing. That's why we invest that amount of time, so that everybody understands what we are trying to do.
How much of your GDP are you spending on the healthcare sectors right now?
Right now, we are spending in 3.7, the official figure, but there's more to that. So we are trying to compile. We are working on an exercise, because there are a lot of investment that is going to health from the private party that is not counted on that statistic. However, the 3.7 is still above what African countries are investing. The recommendation is to invest close to 7. So I would say we are halfway at the current moment.
Okay. Yeah, President Kagame, when he was the president of the African Union, one thing he said was health is currency. And congratulations on winning the award. And we hope other African leaders we understand that health is currency. And without a good, healthy population, you can't have a good economy.
Exactly.
So the turnaround of Africa, continue the work that you're doing, and thank you so much for the work that you're doing and the partnership. Thank you.
Thank you.
It's an honor.
Thanks. Yeah.